Hey guys, it's Dr. B the MP here. Welcome to another episode of Health Tea with Dr. B the MP. My apologies, looks like I was having some technical difficulties connecting, but I am here now. Hopefully, you all are having a great July. So happy 1st of July, 2nd of July, 3rd of July to everyone. Welcome back to another episode of Health Tea with Dr. B the MP, episode 19, NAFLD, What Your Liver Wishes You Knew. So, hope everyone is doing well, especially with all of this heat. Please remember to stay cool and hydrated while still safely basking in the sun because you still need to be soaking up tons of vitamin D. But most importantly, continue advocating for yourselves because your health is depending on you. So, before we begin tonight's episode, here is a friendly reminder if you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and Utah, and you are seeking treatment, the link is in my bio. That is https://bit.ly/health tea with Dr. B. If you are ready to reach optimal health, I am right here waiting for you and rooting for you. I specialize in PCOS, menopause, functional medicine, weight loss, and thyroid optimization. Also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram or Facebook, or send me a message on bit.ly/health tea with Dr. B. So, today we are diving into a topic that's been making guest appearances in many of my patients' lives unexpectedly: non alcoholic fatty liver disease. Interesting, right? So let's get ready for this tea tonight. I'm going to spill some good hot tea, so please be ready. But first, let's get into this hot tea tonight, literally dandelion tea. So, this is the tea for the week. Here we are. Whoops, sorry. Let's see if you can see it. Roasted dandelion root. So, full disclosure. Full disclosure. Yes, I have had this tea already. Do I like it? No, but I'm going to take one for the team and I am going to drink it for you all, okay? Because remember, every time that we do this episode here with Health Tea with Dr. B, the MP, I'm always going to introduce a tea that is going to be related to our topic, which is non alcoholic fatty liver disease. So let's get into this tea, just to show you all that I'm not gaslighting any one of you, okay? So, as you can see, it's dark. It's been steeping for a while, for at least 20 minutes. So, dandelion's tea is made from the roots, leaves, or flowers of the dandelion plant. It has an earthly, slightly bitter flavor, nasty, but to each its own. However, the benefits are absolutely amazing. So, we have liver health. So, it does support the detoxification by stimulating bile production, and it helps to cleanse the liver, improving its function. So, it does not mean that it's going to send you to the bathroom or give you diarrhea. However, it is going to cleanse you out. All right. It also helps to promote digestion by increasing bile flow. It can also help to alleviate bloating and support healthy gut bacteria. It contains vitamin A, C, K, and minerals like iron and calcium and potassium. We need those. So, yes, there are so many benefits with it. It's also an anti inflammatory. So, it contains antioxidants that reduce inflammation and support overall health. And it acts as a natural diuretic, helping to eliminate excess water and toxins from the body. So when I say I am taking one for the team, that means I might be up urinating all night, but that is okay. It's okay because again, the goal is for you all to know what is out there for our health. And this also may help to manage blood sugar levels due to its anti-diabetic properties. So let's get into this taste. Okay, to me, in my opinion, dandelion tastes like roots. I don't know what roots taste like, but I'm pretty sure this I'm pretty sure this is what roots taste like. However, to be quite honest and fair, because of the benefits, I am going to drink it because this is what I need. Okay? Again, I can say that I'm taking one for the team, but honestly, I'm taking it for my team because at the end of the day, I need to support my own liver health because tonight's discussion is going to be super important. And super important because I see so many people with non-alcoholic fatty liver disease. But one second, let me take another sip. Taking it for the team. Mm. All right, guys. Okay, not bad. Just remember the benefits. Okay, just remember the benefits. Okay. So, the content provided in today's session is intended solely for informational purposes and should not be construed as direct medical advice. So, while I aim to share valuable insights and knowledge, it is super, super important to remember that I am not your primary care doctor. The information shared does not replace your doctor's advice, diagnoses, nor treatment. Remember, I do not know you. If you are my patient, then I know you. But right now, I do not have a relationship with you all, and the goal is for you to be safe. So if you have specific health related concerns or you are seeking treatment based on the topics discussed, you are encouraged to contact me directly at bit.ly/health tea with Dr. B or consult with your own doctor for personalized medical advice. Your health and well being are paramount, and getting advice tailored to your individual needs from a licensed healthcare professional is super essential. So, I want to do this one more time because now it is time to sip, listen, and thrive. Mm-mm-mm. Ooh, man, that is some strong tea, especially if you let it steep. When you let it steep, that is it. It is a wrap. But yes. So let's get into our episode 19. NAFLD. Please remember that acronym. Non alcoholic fatty liver disease. What your liver wishes you knew. So, here is a nice little short story. Okay. So, in the past 3 months alone, I have diagnosed over 100 patients with non alcoholic fatty liver disease. And about 95% of them were unsuspecting. So, they didn't even know that they were even on the radar for it. 90% of them had PCOS or metabolic syndrome, also known as MET-S, and we will discuss this later. About 75% of them never had alcohol before, so they aren't drinkers, okay? When I sent them for their ultrasounds, it was just a hunch because their liver enzymes, which we'll discuss later, was elevated. And as a provider, you must go with your gut, especially if you think it will benefit your patient. So I am personally glad that I went with my hunch because these patients had an underlying condition that could have progressed to something bigger, such as liver disease, cirrhosis, and etc. Okay, so let's move on in. What exactly is NAFLD, non alcoholic fatty liver disease? Well, it is a disorder that causes excess fat to build up in the liver. Okay, so I'm not sure if you guys watch anatomy shows, but there is a show where they're doing an autopsy and they show us the liver, and the liver has a lot of fat substance or yellowy substance around the liver that is fat. Okay, so that is the fat. So we hear fatty liver, that is non-alcoholic fatty liver disease. Okay, I have a listener who just asked about the difference between non alcoholic fatty liver disease and alcoholic liver disease. So, non alcoholic fatty liver disease, it is caused by metabolic imbalances like obesity, insulin resistance, and type 2 diabetes, and it is not related to alcohol. That is why many people are confused when they are diagnosed with it. So, what are the characteristics of non alcoholic fatty liver disease? So, fat builds up in the liver due to a poor diet and lifestyle. and it can progress to NASH, also known as inflammation, or fibrosis, also known as the scarring of the liver, and cirrhosis. Okay. Now, what about alcoholic liver disease? Well, what causes it? Of course, excessive alcoholic consumption. And what are the characteristics? Well, alcohol causes fat accumulation, inflammation, and scarring in the liver. So it progresses from a fatty liver to alcoholic hepatitis and cirrhosis. So it sounds much more severe. But what is the main thing here? Excessive alcohol consumption versus metabolic syndrome like obesity, insulin resistance, and type 2 diabetes. Okay. So here is the tea about non alcoholic fatty liver disease prevalence and why it is a growing concern. So NAFLD affects up to 46% of people in the US, and it is increasing globally. So just remember, I said in the past 3 months, I have diagnosed over 100 patients. That's just me alone. There's so many different providers in the US. And it is linked to the global increase in obesity, type 2 diabetes, and metabolic syndrome. So let's think about our environment. Let's think about the foods that we are either forced to ingest or that's available to us. So, of course, obesity is on the rise. Of course, type 2 diabetes is on the rise. Of course, metabolic syndrome is on the rise. And guess what? It affects both adults and children. Okay. And here are some health risks. It can lead to severe liver conditions, including liver failure and the need for a liver transplant. And some related diseases are associated with cardiovascular disease, type 2 diabetes, and chronic kidney disease. To me, this is all scary. Why? Because a lot of these things are preventable, right? They're preventable. However, we don't take proper measures to prevent it. You see how that doesn't make sense? Okay. So let's learn more about the risk factors for non alcoholic fatty liver disease. So we have obesity, type 2 diabetes, high cholesterol, PCOS, also known as polycystic ovarian syndrome, and metabolic syndrome. So, what exactly is MET-S or metabolic syndrome? Well, it is a group of metabolic abnormalities that can be caused by or can cause insulin resistance. So, how do you know if you have metabolic syndrome? So, let's go through the characteristics: high blood pressure, low HDL, which is the good cholesterol, elevated triglycerides, impaired fasting glucose, obesity, especially around the abdominal area, and insulin resistance. So we spoke about insulin resistance maybe a few months ago, and we are actually approaching that time for me to speak about it again. So just listen up. So, what is the impact of metabolic syndrome? Metabolic syndrome can increase the risk of developing type 2 diabetes, atherosclerotic cardiovascular disease, also known as ASCVD. So if you see that on your doctor's report or visit summary, that is what that means. And again, chronic kidney disease. So here is some hot tea, okay? Please get your annual physicals done and ensure that they have checked. Ensure that your doctor has checked your complete metabolic panel and or your hepatic function tests. Those are your liver tests. We need to see what shape your liver is in because I practice functional medicine where a lot of providers practice mainstream medicine. I can tell when your liver is about to act up even when the numbers are within range. Well, what is the difference with mainstream? Mainstream just basically means that when your numbers are within range, they typically are not going to address it unless your numbers are outside of the normal range. Okay, so remember that. That is a good tea. I have met so many patients thus far, and I always ask them, well, hey, when's the last time you've been to the doctor? And they'll say 4, 5, 6 years, and they're usually embarrassed. But there's really no reason to be embarrassed. It is what it is, but the goal is for you to go in there. But I just don't want you I just don't want it to be too late. You see what I'm saying? I don't want it to be too late for you. So please get your annual physical. So if you are going to go to the doctor, you could go at least once or twice a year, and then you can kind of, slow it down a bit. Okay. So what is the connection between non-alcoholic fatty liver disease and metabolic syndrome? Okay. These two conditions are closely linked because they share many similarities. So both conditions can increase the risk for developing the same diseases. And both conditions involve that pesky insulin resistance. Remember, insulin is a bully, and lipotoxicity, which can lead up to a buildup of triglycerides in the liver panel. So, this is your cholesterol panel. That's why it's super important to at least get this panel done at least once a year. Okay, so about 90% of the people with non alcoholic fatty liver disease have at least one feature of metabolic syndrome, and 33% have three or more. So remember the characteristics of metabolic syndrome: high blood pressure, low HDL cholesterol, which is a good cholesterol, elevated triglycerides, that's also in your cholesterol panel, impaired fasting glucose, abdominal obesity, and that pesky insulin resistance. Okay, so let's talk more about the signs and the symptoms. So here is the real tea. Most people who have non alcoholic fatty liver disease never know about it. Never, ever, ever. They usually are caught by surprise. So, here are some common signs and symptoms. You have fatigue, abdominal discomfort, enlarged liver, and elevated liver enzymes on your lab test. So, here is some hot tea that a lot of doctors or other medical professionals will be upset with me telling you all this. Many doctors will see that your liver enzymes on your labs are elevated, but they will not go the extra mile to do the follow up testing. They'll tell you that you will grow out of it. So you need to emphasize the importance of further testing like ultrasounds and advocate for yourself. About 2 days ago, I spoke with a patient and her liver enzymes were abnormal, but off the charts. And I said, I'm not sure what your labs look like with your last provider, but I just need to make sure that you are okay. And here is what she told me. She said, well, my doctor knew I've had it for about 10 years, and they say eventually I will grow out of it. So you heard that uncomfortable silence? So 10 years she's had these elevated liver enzymes, and her doctor had done nothing about it. That is insane to me, people. That is completely insane. Please advocate for yourselves because you just heard about the risks of non alcoholic fatty liver disease. Okay. So let's get into it. How is it diagnosed? So typically a biopsy will confirm non-alcoholic fatty liver disease. Sorry, that is a tongue twister for me tonight. But it confirms it by examining liver tissue for fat, inflammation, and scarring. However, this procedure is super invasive, so that is never the first one we dive into. Less invasive tests that we usually start off with if we suspect anything are typically blood tests. So blood tests, and I'll go through them in a few moments. So blood tests to check the liver function, and imaging tests such as an ultrasound or even an MRI, which is a little bit more pricey because they can show fat deposits and scarring. So you ask, what key tests? Well, we have the LFTs, also known as the liver function test, and they measure enzymes such as the ALT, AST, protein, and bilirubin in the blood. So, normal levels in early stages or elevated levels, um, they start to get higher as the liver damage progresses. So, remember what I said earlier, I'm a functional medicine provider. So, your levels could be normal during the early stages of NAFLD, but they become more elevated as your liver damage progresses. So hopefully that kind of sank in. Once your levels are finally elevated, that means damage has set in. So please let that information sink in. Also, we have the gamma glutamyl transferase, also known as the GGT. That is another enzyme of the liver, and it reflects the liver's effort to detoxify the body. So remember today, I am drinking, taking one for the team, by the way, I am drinking dandelion tea. And this is responsible or it helps to detoxify my liver. Okay. So again, the GGT helps to reflect the liver's effort to detoxify the body. See how those are linking? And then we have blood sugar and metabolism markers. So remember, we did speak about type 2 diabetes. So we need to check fasting glucose, hemoglobin A1C, which averages blood sugars over the course of 3 months or 6 weeks, a fasting insulin level, and a C peptide, which is a marker that lets us know that the body is producing insulin. So, insulin resistance, remember, insulin is a bully, and how the body handles blood sugar can lead to inflammation, heart disease, type 2 diabetes, and non alcoholic fatty liver disease. So, hopefully, you all are seeing how everything is kind of connected in one big circle. Okay. The next blood test we're going to discuss is the lipid profile. That's the cholesterol profile. So, what is it measuring? The total cholesterol, the HDL, also known as the good cholesterol, the LDL, the bad cholesterol, and we'll have a nice podcast about LDL, okay, and the triglycerides. And then we have advanced markers called the lipoprotein A, the LDL particle number, and the ApoB, which provide detailed risk assessments for heart disease. All right. And then we have our inflammation markers. So a high sensitivity CRP, which measures inflammation levels in the body over time, but it's produced by the liver. Okay. So just remember that inflammation markers are just that. We can't really determine where the inflammation is coming from. We just know that the inflammation is in your body. And then we have gut health, right? So a comprehensive stool test, I know that sounds so gross. However, stool test helps to assess gut bacteria, inflammation, leaky gut, SIBO, and pathogens. And remember that the importance of this test is that when we think about our gut health, we have to think that a healthy gut prevents food and other substances from entering the bloodstream and causing liver inflammation. Okay? So, a healthy gut. I am sure that a lot of people out here are walking outside right now with poor gut health. So, think about it. Are you consistently having diarrhea? Are you consistently having constipation? Are you consistently bloated? Are you consistently having abdominal pain? So there's a lot going on there. Okay. So gut health is super important, right? But here's the T: blood tests alone do not determine whether you have non alcoholic fatty liver disease. So even all that I have read over to you regarding the key test to kind of dive deep into the liver, they don't say, hey, you have non alcoholic fatty liver disease. Now you've done the first part. Your second part now is to kind of dive deep and order that ultrasound. Please order that ultrasound. Okay. Because that is the T. Blood test alone cannot determine whether you have it. So please do not let a provider see that your enzyme is elevated and then say, oh, you have non alcoholic fatty liver disease. No, it doesn't mean that, but it means that we should check. Because guess what? Your liver could be, your liver enzymes could be, inflamed due to another reason. All right. Okay. All right. So one of my faithful listeners just asked about the connection slash link between non-alcoholic fatty liver disease and PCOS. Everyone knows that I'm a PCOSer, and I love PCOS. I love treating PCOS. That is my most favorite thing to treat right now. So what is the connection really? Insulin resistance. Remember that insulin drives PCOS. So both PCOS and non-alcoholic fatty liver disease are linked to insulin resistance which is a condition where the body's cells do not respond well to insulin, and it leads to higher blood sugar levels. Okay. What else about the connection? Metabolic syndrome. So many women with PCOS also have a metabolic syndrome, which includes, again, obesity, high blood pressure, and high cholesterol, which are all risk factors for non alcoholic fatty liver disease. And both conditions involve chronic low grade inflammation, which contributes to liver fat buildup and liver damage. So remember earlier, I started off with my personal story and how I treat my patients. I mentioned that 90% of my patients, so they're my female patients, had PCOS. So out of my over 100 patients who I diagnosed with NAFLD, 90% of them had PCOS. Okay, so you see how tight that connection is. All right. All right, hot tea alert, hot tea alert. So give me 1 second so I can take one for the team again. Talking about this really does make me want to clean out my liver, which is why I'm drinking this tea. So hot tea alert. What is the role of sex hormones in non-alcoholic fatty liver disease? So we never really think this far. Shoot, we didn't even think this far with NAFLD. All right, we're just learning about metabolic syndrome, insulin resistance, and PCOS and the rise, right? But we never really put two and two together when it comes to our sex hormones. So let's talk about estrogen. That's the dreaded word here. Estrogen, estrogen, estrogen. Every time you talk about estrogen, somebody always is misinformed and says estrogen causes cancer. Well, that's not true. Not in that light, you know. So here's what I want to say when it comes to estrogen. Estrogens regulate liver metabolism, promoting the oxidation of fatty acids and reducing inflammation and lipid synthesis. So, what does that mean? They contribute to lower non alcoholic fatty liver disease prevalence in premenopausal women. However, estrogen deficiency, as seen in menopause, because remember, menopause means the cessation of your ovaries, which means no more hormone production. So, estrogen deficiency increases the risks of non alcoholic fatty liver disease. Did you all know that? That is some hot tea. What about androgens, like testosterone? In men, androgens like testosterone also influence liver metabolism, but their effects can vary. So, having low testosterone is linked to insulin resistance in non alcoholic fatty liver disease in men, while high testosterone levels in women, those who have PCOS, can lead to non alcoholic fatty liver disease. Did y'all see that? Did y'all see that? Let me read that, Corey. Let me read it back. Low testosterone levels are linked to insulin resistance in non-alcoholic fatty liver disease in men. However, women who have hyperandrogenism, which means high testosterone levels, they have a higher risk of non-alcoholic fatty liver disease. So do you see how sex hormones in different genders plays a role in non-alcoholic fatty liver disease? So whenever my male patients come to me for testosterone replacement therapy and they are men, my men who have testosterone deficiencies typically have visceral fat, subcutaneous fat, that's fat that hangs around their abdomen. They usually have metabolic syndrome, low libido, high cholesterol, elevated triglycerides, low HDL. But as soon as they start on testosterone and stay consistent for about 6 months, guess what? Just guess. Their numbers decrease. Their numbers decrease as far as their cholesterol levels, their testosterone levels go through the roof. And guess what? they have lost about 60 to 80 pounds, and they have now reversed their cholesterol. That is something to think about, honestly. So here's a hot tea tip, okay? Women generally have better dietary habits and lower visceral fat, contributing to their lower non alcoholic fatty liver disease risk until menopause. So basically, what I just heard is that once you go into menopause, things get shot from there. Everything goes down. So hopefully, you all are picking up what I am putting down because this is important. This is truly important. Okay. And that was a nice little tip in connection with the sex hormones. No one ever really relates sex hormones to non alcoholic fatty liver disease. So let's talk about lifestyle changes. So, how can you treat and manage it? So, of course, we have weight management. So, people lose weight gradually and maintain a healthy weight. That's why we see the reduction of non alcoholic fatty liver disease when we place patients on GLP-1s or GIPs, such as Wegovy, Ozempic, semaglutide, Mounjaro, and Zepbound, and tirzepatide. Studies show that tirzepatide or Zepbound or Mounjaro really help to eliminate or decrease the risk of fatty liver disease. So that is something to look into. But lowering your blood fats. So you need to reduce the fats that's in your blood. Balancing your blood sugar. So you have to improve how your body handles blood sugar and insulin. So all of my carboholics, please remember that carbs turn into sugar. So even if you take sugar out of your diet, your carbs are still there, making it almost impossible for you to stay away from the sugar because the carbs break down into sugar and the sugar likes to circulate in your blood. And guess what? Sugar does not belong in your blood. You also need to avoid liver stressors. So stay away from alcohol. I know that's a hard one. So moderation. Um, Avoid high fructose corn syrup and processed carbs. But let's really dig more into nutrition because this isn't spoken about a lot. Diet is crucial in the development and management of non alcoholic fatty liver disease. So, proper diet and lifestyle changes can control or even reverse fat buildup in the liver. So, we need to adopt an anti inflammatory diet, also known as the Mediterranean diet. So, this diet includes healthy fats, vegetables, fruits, nuts, legumes, whole grains, fish, and seafood. It reduces red and processed meat and limits excess sugars. So, here's my thing, guys, because a lot of my patients will say, "Hey, Dr. B, you always talk about how we should eat red meat." I do say that. However, remember that certain things go for certain people. Okay? Just remember that. And we'll discuss red meat on a different occasion. So, what are the benefits of the Mediterranean diet? Well, it improves your liver health, insulin levels, blood sugar, and cholesterol. And it emphasizes organic citrus fruits, vegetables, legumes, complex carbs, fish, and olive oil. So, adding green vegetables rich in polyphenols further supports liver health. So, what are your key foods? You have your cruciferous vegetables like your broccoli, cauliflower, kale, Brussels sprouts, garlic, and onions that help to detoxify the liver. And then you have choline, which is found in egg yolks, animal protein, chickpeas, and legumes. And choline is essential for transporting fat from the liver and overall liver function. So, choline is needed. All right. And of course, we need a sustainable weight loss. So, gradual weight loss of 5 to 10% through caloric restriction and exercise helps to improve liver function and reduces inflammation. Okay. Now, how again can we avoid liver stress? By avoiding alcohol, processed carbs, and high fructose corn syrup. Because remember, this is what's going to help improve your liver health and reduce non alcoholic fatty liver disease. So now let's reiterate protein. Include protein in every meal to balance blood sugar and support liver function. So when you are avoiding sugars like high fructose corn syrup, choose water, herbal teas, and whole fruits and vegetables instead. And please incorporate healthy fats like olive oil, avocados, nuts, salmon, and flax seeds to help maintain balanced blood sugar and appetite. Okay. And there are those who want to go the plant-based diet route, which is fine because a diverse diet supports good gut bacteria, aiding in liver detoxification and digestion, which is what we need. But also remember that we also need probiotics, which helps to reduce inflammation and improves our liver function. But remember, when you are taking a probiotic, please change it every 6 months to get your body used to the different types of bacteria. And then try to consume prebiotic foods like garlic, bananas, and asparagus, which helps to feed healthy gut bacteria. Okay. Now, what about exercise? Well, regular activity helps to manage blood sugar, reduces liver fat, and boosts detoxification. So that sweating that you're about to do, it helps to remove the toxins that stress the liver. So sweating is good. Sweating is your friend. Okay. And now, of course, we can always change our diet, but let's also add some nutrient support like antioxidants. So, vitamin E, alpha lipoic acid, which is thebomb.com, and N-acetylcysteine, also known as NAC. These things help to heal the liver, and they can be found in almonds, sunflower seeds, salmon, and avocados. Then you have herbs like milk thistle and turmeric, which will help to regenerate the liver. And then we have panthenine and omega-3 fatty acids and magnesium, which helps to support fat processing. So there is so much out there. And then we have bowel support. So we have to stimulate bowel flow. And you know what bile is. When people throw up, what color is it when you throw up? It's like green. That's bile. Stimulate bile flow with foods like artichokes and bitter greens such as dandelion. That was my cue to drink. Bitter greens like dandelion, they help to support or transport toxins from the liver for excretion, hence the dandelion tea. Okay. Listeners, my faithful Health Tea with Dr. B, the MP listeners, please share your stories. Please ask questions for future episodes because there are so many health conditions that we are seeing on a daily basis. And these conditions have been out for a while, but no one is really talking about them, or a lot of patients are being brushed away, swept under the rug. So everyone knows that yes, I am a doctoral prepared board certified nurse practitioner and I own True Phoenix Community Care. I look for these things. My team at True Phoenix Community Care, we look for these things. We're not going to send you away. When people come to my office, it is because they were referred or they found us by accident sometimes. But people are usually referred to us and they say, "Well, I heard that you find things." Yes, that's what we do because we can no longer sit around and just be sick and tired for no reason. Who wants to be like that? So if you think you have non-alcoholic fatty liver disease and you want to get tested, please let us know. I can help run the test. Okay. So thank you all for attending and supporting Health Tea with Dr. B tonight. Like, oh my gosh, I love you guys. We're at episode 19. In 2 weeks will be episode 20. Okay. So please follow us on Instagram, Facebook, YouTube, TikTok. Please also follow my clinic, True Phoenix Community Care, on TikTok, Instagram, Facebook. Please, okay? And just remember, if you guys have any questions, please do not hesitate. Visit me at bit.ly/health tea with Dr. B. If you want to become a guest on the show, share your experiences, please do not hesitate with doing so. Okay, so thank you all again for joining tonight's episode. You all are so appreciated. I appreciate every one of you. Please take care. Have a safe 4th of July. And I will see you all in 2 weeks. All right, guys.